being here after lunch. I see the lunch looks really good. It's delicious. So it's a nice thing that Franklin Township, does on a daily basis.
She's the best.
Excellent. So, my name is Jason DeMarco. I own a company called Insurance Solutions. I'm in Marlton, New Jersey. I actually handle the insurance for the township employee benefits. But I also deal with the Medicare people as well, which means that not just with Franklin Township, but I deal with individuals under 65, along with employees that are over 65 as well. So when I spoke to the township, I offered I volunteered here to speak to the community, to the senior center, and for those of you that are here today, to sort of go through Medicare. Every year is a very important time of year, which is called the annual enrollment period. So I sort of wanted to give you my thoughts because, since I handle Medicare on a yearly basis, I want to sort of give you some things to think about, with your Medicare choices, which you may have done already, or you may not have, or may not even thought about it. But I want to make sure that I'm here as a resource for you guys, for the township, as long as you guys need me. I am never going to go away. I'm always going to be here. Township has my information. You folks will also have my information if you need to call me on a direct basis. So I've been in this business for 30 years. I've got 3 girls and a wife. One daughter is actually just graduating college. I have one that's in college and one that's graduating high school. So I'm going to be here for a long time because I got college tuition and weddings and all kinds of stuff. So I'm going to be around for a long, long time. I do want to introduce one of my co-workers. He's sort of my behind-the-scenes person. Rich, raise your hand. Rich basically does a lot of my processing and stuff, and sort of I'm not in the office. Rich is the go-to guy as well to sort of ask some questions, and he can sort of direct you as well. So I wanted Rich here, not just to give out tickets and stuff like that, but I wanted everyone to see him, and see who he is, because Rich is sort of, a pretty good guy that backs me up, which is a big thing. So I'm going to be here to answer questions and all that stuff. I'm going to go through my presentation, and I'm sort of going to, ask some questions. But if there's something that comes up that you think is important to you, ask it. Raise your hand, blurt it out, whatever it is, we'll talk about it. If it becomes personal, we're going to pull that off the side and do that after, because I don't want to go into somebody's, personal stuff, especially on, being videoed and stuff. I'd rather talk about that on the side screen. We'll go through the presentation, we'll ask questions, and then before you leave, I got a raffle going off, so I got some things to hand out, which I always love to hand things out. I may quiz you on certain things. So we'll see how it goes. Any questions for me before we start? Rock and roll. So, just talked about myself. Here's Rich. I also have a person by the name of Lori. She's in my office as well. She answers the phones, and she's also supported mine as well. We work as sort of like, 3 of us, but we actually have a couple other people in the office as well. But when we start talking about this on an annual basis, this is sort of who our team is. We are a trusted advisor. We're a partner. We are someone here that's not selling you anything. We're here to advise. My role is to be that resource for you folks. If you are looking to make changes or whatever, I have the capabilities of doing that. I have the capabilities of doing reviews, analysis. I can be there to take your hand and bring you through to make any changes if necessary, because as we all know, insurance doesn't stay the same. Things do change either on your plan or behind the scenes. Here's what we do for you. We listen to your needs. Some people just in one ear, out the other. We answer your questions when we understand them, because sometimes it's very difficult to answer a question when the person is not sure of what their question really is. So we try and get down to that to make sure we know what you actually need. We educate you in your choices. We help you control cost. That's what it's all about. Let's make sure you get the biggest bang for your buck year after year because of the changes that do occur on an annual basis. We do assist you on your annual enrollment. So right now, this is the annual enrollment time. So it's called the AEP. You see all the good commercials on TV. Do this, do that. This is zero. This is blah, 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 blah. All of that This is the time where it starts from October 15th through December 7th to make your changes in some of your plans. Not all of them, but some of them. We help you with billing issues. Sometimes you may get this bill. Do I pay it or don't I? Did it get processed correctly? So sometimes we say, call in, let's find out, and if not, we make a call together with the insurance company. As Rich knows, we actually say, let's see the bill, the statement, and we'll see if we can decipher as well to be on your side. We give recommendations during the reviews. So we do it annually if you want. It's up to you. There's changes that happen. We get certified every year. I start from July on. I get certified by all the carriers that I represent, which is a lot. And we go through the testing, and we have to go through, understanding what the changes are, and we have to see what's going on, for the following year. So we get a crash course, whereas you guys get a crash course right at the beginning with the book which says Medicare New Book. You get that whole book, and then, okay, what does this all mean? Well, we have to crash course that as well before we talk to you folks. So here's our agenda today. We're going to talk about some of the changes in Medicare for 2025. There's this big thing that's going on now for the prescription drug program. The Inflation Reduction Act is big for 2025. For those of you that are taking prescription drugs that are expensive and you're paying a lot of money and you're going into what they call the donut hole or the catastrophic level, that's what's happening now. All changing next year. It's being revamped for 2025. So we'll talk about that. Medicare Advantage plans terminating. How many people here have Medicare Advantage plans? How many people have supplement plans, Medicare supplement plans? Okay, how many people are enrolled in a plan through an employer? How about those that are retired and in a plan? Okay, so we're going to allude a couple things, because if there's retirement benefits that you're on and they're paying for it, you're not going to change. You don't have to. You're going to stay on that plan because you're not paying anything or very little. So we can always have that dialogue as well. We'll talk about choosing the right Medicare Advantage plans out there. How do you do it? We'll talk about Medicare supplement plans. Can you change those plans or not? What do you do after a rate increase? That's one of the things that says, I got a rate increase, what can I do, especially on my supplement plans or my prescription plans. And then we'll talk about a little bit of additional benefits that you may not be aware of that may complement what your programs are all about. All right, hot off the press. For those of you that are, obviously have Medicare, and you're collecting Social Security. Everyone collecting Social Security right now? So your deductions for your Part B premium is coming out right now. So right now it's going to go up $185. Okay, it's going from $174.30. What's it? $174.70 up to $185 for next year. This is hot off the press. This came out Monday. This is the new and approved, cost. Now, if your income is higher, I don't know if any of you got caught with IRMA charges, income-related monthly adjustment costs. So if your income is a certain amount, your Part B is higher. So since none of you, know that, I guess you're sort of on the playing field. And it looks like you're going to get an increase on your cost of living of about 2.5%. Okay, that's what's going to happen this year. Last year was a pretty big increase. This year it's sort of normal. Inflation Reduction Act. As you can see, it was signed into law on August 16, 2022. And what does this do? This is basically part of the prescription drug program, which I think started when it started in 2006. It was a program that was very erratic. It was very difficult to understand until you got into the program and you realized that you're paying a lot of money for your prescriptions. You're taking brand medications. Well, they're revamping it. And you're going to see that this was signed into law 2 years ago, 3 years ago, and now it's going to go 2025. You're going to see that you're going to be capped on what you can spend on your prescription drug program, which is phenomenal. This is going to help. This is sort of the timeline of what the changes are at a glance. You're going to see that we're down here. So before that, 2023, they capped insulin at $35, eliminated costs for adult vaccines. Then you're going to see 2024 low-income subsidy expansion, so they increased it up for PAD, P-A-A-D, if you're familiar with PAD. We'll talk about that if you're not. 6% premium increase caps, so that's nice as well. You're not going to get anything higher on some of those things. Pharmacy networks, some of them have changed a little bit. Some are good, some are bad. 2025, you're going to see what happens here. That's what we're going to talk about. And then you're going to see 2026 to 2028. Now there's going to be some negotiations on the prescription pricing, which is going to be year to year. Okay? This is sort of the timeline and the changes. So here's what you should notice. There's this letter that came out in September called the Annual Notification of Coverage with any of your plans, with a Medicare Advantage plan or a prescription drug plan. That notice does tell you what your changes are going to be. It could tell you what your prescription drug program, prescriptions could change. It could say it's on formulary and now off formulary. So it's a very important piece of documentation that when you do get it, read it, because that's pertaining to you, because they identify what you're using and they're going to tell you what those changes are. A lot of people throw them out, don't look at them, and all of a sudden the following year they find out I can't get this service, or my prescription went to this, or I can't get my prescription. That's because that annual notification of coverage is very important. One of the biggest things that's happening for next year is that for those of you that are on these high medications, the Humaras, the Skyrizi, the rheumatoid arthritis, the diabetic injectables, they're very expensive. What's happening this year is that you're capped at $2,000, but they call it the M3P plan. It's going to work like this. It's called smoothing out your payments. So let's say January, you have these prescription drugs, and they're expensive, January 1st or within the month of January, you get your prescriptions, you go to the pharmacy, and all of a sudden, you're getting 3 or 4 of them, and all of a sudden, you just got hit with $2,000. But that's all you're capped at, because Humira is expensive, it's on the, it's a percentage now on your plan, and this and that. This M3P smooths out the rest of your payments for the rest of the year, the payment plan. You enroll with the carrier online, you make a phone call, and you can actually get that payment plan through your carrier, prescription drug plan, or your Medicare Advantage plan that has prescription, and they will smooth that out. So when you go to the pharmacy, you pick up your medication, and that carrier is specifically going to bill you, the rest of the months on that plan. Which is good, it helps, because I get a lot of my clients that come to me and say, I can't afford it, Jason, so I'm not going to take it. And then what happens? Now your health starts to fail. Now you got some other issues going on. It's a great idea of what they're doing here to help an individual that takes these medications that are expensive, to cap them out, or not cap them out, but smooth them out. There's no discounts on it. It's the plan, but you're going to have that payment plan for the rest of the year. A lot of things that happen with that. If you stop paying, they're going to give you some notification. I have that on my slide, that they could terminate you, but they're going to give you notification if you can't pay that monthly cost. So there's a lot of things that they will work with you. They're not going to just cut you off, but they will work with you to make sure that you're not going to get cut off if you can't make payments. This is sort of an example of what happens when I call it the smoothing process here. Okay, how it gets adjusted. You can do, you're going to get your $2,000, they're going to adjust it underneath 167 for those 12 months. Scenario 2 is 1,000. You're going to see how it works. And you're going to see scenario 3, it's, really doesn't work too much here on scenario 3, but it can. Those of you that have prescription drugs that are costing, let's say $700 or more, the smoothing process could work. Anything underneath of that, it ain't going to work. You just pay it as is. That's what I see out there for this. Okay. Likely candidates, members with high drug costs in a year, members who spend $2,000. Those are the likely candidates. Unlikely candidates, members with low drug costs, members with the same drug costs every year, every month. Unlikely candidate, members who join after September. So September, you're not going to do it. That's not going to work. And members who receive extra help. So if you're on low income subsidy, you're on PAD, PAAD. It's not going to help at all because those programs are, little to no out-of-pocket cost. Okay? Shifting to another topic. As you can see, there are plans, Medicare Advantage plans, and some prescription drug plans that are terminating next year. So you may have gotten a notice, so anybody that's in Aetna on an individual Medicare plan, well, you already did. You got that notification that your plan has been canceled. So Aetna has done about, 6 to 8 plans that they've terminated. They still have plans out there, but they terminated those plans because they were restructuring their benefit program to keep it consistent, keep it, profitable. So some of those plans have terminated, and you're going to have to make a change. They're not pushing you into another plan, so it's your choice. So we've been working with clients already about making their choices and doing their comparisons of what they had to what they are now. Some of the prescription drug programs are consolidating down to one plan. So sometimes you may have had a carrier, a Humana, or an Aetna prescription drug plan that had 2 plans, and now it's just consolidated into one. So that's something to look at as well. But they actually those plans on the prescription drug would sort of cross you over to those plans in the prescription drug. Okay? There's also another company out there called Braven, which is a Horizon Blue Cross and Blue Shield partnership with some of the health systems out there. They're called Braven. They put some plans together, so they are disrupting the marketplace, and they've got some plans out there that are, that are helping to adjust, for some of those terminated plans as well. But there's a lot of plans out there that you can look at. There's probably about 10 or 12 of them. So I have a question for you. Anybody know the difference between a Medicare Advantage plan and a Medicare Supplement plan? Go ahead.
The Advantage plan is usually included with your old plan, and the supplemental you pay extra.
That's good.
I call it secondary.
It's a good plan. That's good. So yeah, there's components in there. So let's elaborate on that a little bit more. Medicare, well, it should be here. Let's go down to Medicare. Actually, these are some of the Medicare Advantage carriers that are out there that you see on TV, that you might have gotten some marketing literature, you may have gotten a bunch of other stuff. But getting back to Medicare Advantage plans versus Medicare Supplement plans, Medicare Advantage plans replace traditional Medicare A and B. Okay? So we have your cards up here. So you have your Medicare A and B, that's traditional Medicare. As you can see, Part A and Part B, traditional Medicare. You buy a Medicare Supplement plan that goes on top of your Advantage plan, and they handle all the Part A and Part B stuff, which is hospitalization, doctors, labs, x-rays, you name it. There's no networks, there's no restrictions. You go wherever you want to go in the country. Okay? There's plans out there, Plan F, Plan G, Plan N. They are supplement plans out there. They're rated according to age. They're rated zip code or state. They are also rated tobacco or non-tobacco, and male and female. So they rate them differently. Every carrier's got a different rate because of their underwriters. So you got to be careful to see, if your plan goes up or not, and can you change or not. Supplement plans have pre-existing conditions. They're like life insurance plans. So if you want to make a change to supplement plans from one change to another, you're going to have to answer health questions, right, Rich?
Right.
They have to answer them. Rich does a lot of my applications for people that are changing. They ask for, what are some of the criteria they ask for, Rich?
Basically, it's your medical health histories. Depending on the questions in particular, it could be within the last 2 years, could be within the last 10 years. A lot of the stuff really revolves around diabetes, and if you have diabetes, how well you have it under control, blood pressure, and then heart, arrhythmia issues, cancer, which I don't know if you're going to talk about cancer probably.
We will.
Cancer is a big one, obviously, for I think you understand why, but it depends on how long ago you've had it, if you're still being treated for it.
So as you heard, Rich does all the processing. So prescription drugs are a major concern when we're looking at changing supplement plans, because you may say you don't have a heart issue, and all of a sudden we look at your prescription, you're taking Plavix. Well, that could be used for the heart. because of a heart attack or whatever. So these insurance companies or underwriters will go into that and dig into it to see, if these questions are right or not, and they're going to make their decision on you and their criteria if they accept you or not. Okay? If you're in a supplement plan, so you're in a great spot. What you're doing, you're trying to change the plan to try and save some money. Okay? All supplement plans are standardized. So all plan Fs are the same. All plan Gs are the same. All plan Ns are the same. They all have the same level of benefits because why? They are a secondary payer to traditional Medicare. Okay? These plans never change. The supplements, that is, but your traditional Medicare, some of those deductibles and co-insurances do change. But the supplements obviously pick them up. Advantage plans, bundled all into one. They replace traditional Medicare, so now you have all the pieces together. They're called Part C plans, okay? As in Charlie. It brings in your medical, brings in your prescription, it can bring in over-the-counter, it can bring in gym, fitness, memberships, it can bring in vision, dental, hearing. It'll bundle it all together for a very low price or no price, okay? However, I get a lot of people that say Medicare Advantage plans versus supplements, and I have two different people on both sides, and the Advantage person says, why pay nothing for my Advantage plan? And I got the supplement person that says, why pay nothing for my supplement plan when I go to a doctor? They're both right, but they're talking different sides. Supplements have very little to no out-of-pocket costs. Advantage plans have very little to no premium, but when you go to the doctors, you're paying as you go. So there are co-pays to most services out there. Okay? So that is the differences between supplements and Advantage plans. If you're in a supplement plan, you do not get prescription drug plan in there. It's a separate plan called a Part D, as in drug, that you buy separately that will work with your insurance. So that's why they call it a standalone prescription drug plan. Whereas the Advantage plans are built into the Advantage plans all in one. Okay? Okay. So these are the Advantage plans. Very important. You're in a Medicare Advantage plan. You must check what we do, and Rich knows because we're busy right now with the annual enrollment period. If we're making changes or your plan design has changed, there's two big components that we talk to our clients about. One is we got to make sure your doctors are in the network. Very important. Two is you got to make sure that your prescription drugs are in line, so you're not spending a fortune on that plan as well. So we take those two components and then we bring the plans that are there that suit your needs, because everybody's different. I get a lot of couples out there that say, well, I'm going to go on the same plan as my husband or my wife. Or I want the same prescription drug plan on the supplement, as a standalone. And that's perfectly fine, but you may be selling yourself short by spending more money for something that that's not necessary. You may have something else that's better out there for the individual, because these plans are all individual. Okay? Very important. Medicare Advantage plans also, as you can see out there, they do. Remember I told you that your Part B premium is $185 next year? Some of these Advantage plans give you money back on your Part B. They call it a buyback. And there are carriers out there that instead of you paying a zero premium for their Advantage plan, you may be able to get money back on one of the plans out there, or a couple of them. So instead of you paying that $185, there's plans out there that's $100, $124, $70, $60, all depends on the carrier and what they offer, that will give you a credit back into your Social Security. So what does that mean? You have more money in that check when you're coming out. But you're going to sacrifice a couple things. You may have higher co-pays. You may not have all of the additional services such as dental, vision, or hearing, or you may be capped at a lower thing. So there's some giveaway to it as well. And that's something that you evaluate, and we talk to our clients and say, does this make sense or not for this year? Because remember, Advantage plans are for the year. You're only locked in for the year. Next year, these plans change again. So just like we're doing this year, and we look at what the changes are and do the evaluation again. So it's very important. PAD, anybody have PAD? P-A-A-D. It went up this year, or this year it went up. So if you're making $52,000 or less, you can capitalize on applying for PAD, pharmaceutical for the aging disabled in New Jersey. It's a state plan where they will subsidize your prescription drugs. They will also, and there's also things there for heating and electric as well. It's a very, very good program for those of you that are in that, that 52,000 or less. So I would say if you're in that, go online, Google PAAD, and you'll see the requirements. You do the application online or print it out. They're going to ask you a whole bunch of stuff. Send it in. If you get accepted, it's a home run. You get all these additional benefits. So it's a pretty good program.
Could you piggyback that with something else, with another, like LEAP, LEAP?
So yeah, we have, so with the PAD, yeah, when that, it's all coordinated through the Centers for Medicare Medicaid Services. So whatever you are the highest, that's what we'll do. But the PAD in general is a specific application that you have to apply for.
Okay. You do it online too?
You can do it online. One of the things that you see out here in the Medicare Advantage plans, so let's say these Medicare Advantage plans have a cost to them. $100, right, Rich?
Yep.
They have a $100 plan. PAD can subsidize most or all of that premium on those Medicare Advantage plans. So you can get a better program for no cost. I was just with a client yesterday. She was one of those that the plan got terminated. She tells me she's got PAD, so that's great. Let's put you in a plan that's cost, $40. You get lower co-pays for this, that, whatever. It's a beautiful plan. It met all her needs. She's got more dental, more hearing, more vision. Since she has PAD, it goes to zero. She pays nothing. He subsidized it. So it was really nice, and she was pretty happy that I came in there and showed her that. So it was pretty cool. So that's some of the advantages to that. Yes?
My understanding, if you have PAD, then you don't have to keep your prescription plan Part B?
No, so your PAD is the entity underneath, but in an Advantage plan, you're going to be, the program is subsidizing, so in an Advantage plan, you're going to have that prescription drug plan.
But I don't mean Advantage plan, I mean.
And a supplement plan, you can keep your program, or PAD will put you in their specific prescription drug plan, which is one of the carriers.
Okay, so if I qualify for PAD, then I would not keep my Part B that I'm paying for right now.
You have the option. You can, because they'll give you a form saying, do you want to change your prescription drug plan, or do you want to go with the PAD Part D plan? Okay? It's all going to work the same. Obviously, my other question is, I already asked this, but those of you who have a lettered Medicare supplement plan, who pays the majority of the claim? So you go into the doctor, you go into the hospital, and you have Medicare red, white, and blue card, and a supplement. Who pays the lion's share?
Medicare.
That's right. Your supplement picks up the difference. That's right. You guys getting that? Actually, let me go back to this. There's one point here. See this point right here? Part B deductible. Those of you that have traditional Medicare with the supplement, your deductible is going from $240 to $257 next year. So those of you that have a G plan, supplement G plan, you're responsible for the deductible. For those of you that have an N plan for the supplement, you're responsible for the deductible. For those of you that have the F plan in the supplement, doesn't matter. The supplement plan picks that up regardless. You're not responsible for the deductible plan. Okay? But this is going up. So those of you that have a supplement plan, you're going up from 240 to 257. Here's the Plan F. You're going to see right here, Plan F. 100% coverage. Those of you that turned 65 and got Medicare Part B or got Part B 2020, January 2020 or before that, you're able to get Part F, Plan F on a supplement plan, and you're also able to change it year after year or month after month. because these are not held into the annual enrollment period. For those of you that turn 65 or Medicare eligible after 2020, this plan is discontinued for new eligibles. Best plan now is the G plan. So the G plan will be the best option, which the only difference is the deductible. You're responsible for $257. It's exactly the same. And the plan N, for those that you don't know anything about the plan N, it's becoming more popular because the premium savings is about 35, 40 bucks between the G and the N plan. But you're going to have some additional out-of-pocket costs. You're going to have up to $20 for an office visit, $50 emergency room visit copay. And you have excess charges, which means that the doctor doesn't accept the allowed charges reimbursed by Medicare. They could charge you, and your maximum out-of-pocket on that expense or that balance bill is 15%. Okay? Not that I see it much, but it's in the plan. Whereas the G plan or the F plan does not have this excess charge for balance billing. Here's an example. Plan G, paying $220 a month, annually $26.40. You know, same insurance, you can switch. It's pretty simple. As Rich said, we change plans by just going through the medical questions. It doesn't hurt to look. If your health is good, requires that there's no issues. Same plan, different name on the card. You can save some money. This is sort of an example. And obviously, if you change to an N plan, save even more money. If a doctor accepts Medicare, must he or she accept my Medicare plan?
No.
You said, what'd you say?
No.
You said no?
Say yes.
Yes, please. Yep. Medicare supplements follow what traditional Medicare does. Okay. How's a claim paid, especially in the supplement world? You go to the doctors. Okay, claim goes to Medicare. That's traditional Medicare A and B. Then it goes to your supplements. These are just a few. They pay the difference, and that's it on the supplement side. So it goes, doctor goes to Medicare, then Medicare sends it over to your supplement, and then whatever if there's out-of-pocket cost, goes to you, if that's the case. Advantage plans, it's that one card, and it goes right to them, and you pay your copay or whatever the percentage is, and you're done. So there's two sides to how claims are paid between the Advantage plan and the supplement plan. Can I qualify for a lower supplement premium? So here's some of the questions. Rick's alluded to some of them. These are the questions. Have you been in the hospital twice in the last year? Have you had cancer in the last 2 years? Do you have any surgery scheduled going to physical therapy? Are you in a wheelchair? Do you require oxygen? Have you had a heart attack in the last 3 years? Do you take more than 50 units of insulin? Some of those questions are considered knockout questions or not. So that's why we look at the questions according to your health, see if they make sense, and if that's the case, we go to app and we see if you can change plans to save some premium. So I get this, I like this, can I change my supplement? We don't take your insurance. Now I get this all the time. And this could be from a new enrollee to someone that's been with me for 10 years, 15 years, and we change a supplement plan, and I'm talking specifically supplement, and I always get that person, you walk in there, and you say, I've got XYZ, that no one's ever heard of. It could be Jason DeMarco's insurance company, supplement plan G. And of course that person on that side will say, we don't take it. Then of course I get the phone call, Jason, what'd you do to me? They don't accept it. Would you put me in? I want out of it. And of course, now there's anxiety going on. So of course I say, calm down. Let's call up that person on the other end over there and say, and let's educate them in a very nice way. And we tell them that you're wrong. And that you shouldn't be you shouldn't be telling people that because you're not aware of the differences. And when we get that straightened out, it's all, it usually works out because we send the message pretty loud and clear. But I get this all the time. All the time. Even when people are with me for so many years and I change supplements, is my doctor going to take it? And they forget. Traditional Medicare is primary. Okay? So I tell you, is your plan changing in 2025? If it's so, if you want, you call us. It's free. My costs are nothing. My services are free. We do this because we want to make sure that people make the right choices for their right situation for the year. Because your situation changes year to year. You can have a great year, and next year you have a fall, hit your head, you got a bleed, whatever. So we have to look at that year after year. As I said, no one pays me anything as the client. I get compensated by the carrier when I submit an application on your behalf. And if we don't submit an application on your behalf, no big deal. I'm still there with you. We're still going to answer your phone calls. We're still going to review. We're going to tell you what's right and what's wrong. We have a carrier out there right now that's not paying commissions for, on the prescription drug plan. So what happens? We're a trusted advisor. We're still going to let you know if that's the right carrier or not, even though we're not getting compensated on it. Either you go there or you stay there, because that's how we work. The reputation is more important than me trying to make $1 or $2. I'm here for you guys. Like when I started this business, my grandfather had a plan, and it was the ARP plan. He goes, I got an ARP plan, but he had no idea what he had. And when I saw the confusion going on, I said, let's talk about it and let's figure this out. And that's why I like this business, because I like to make sure that people know what they're getting and not being told by other people what they should and shouldn't be doing, because this is your choice and your choice only. Okay? So, I think I am going to wrap it up because I spent a little bit too much time talking, but I'm here. So we're going to ask some questions, if you have any, and then if not, I got a raffle going on, so we can win a couple things here, and then after that, wrapped up, go home, enjoy the day, and do what you got to do. Any questions for me?
At what age do you need to have insurance?
I'm sorry?
At what age do you need to sign up?
So let's talk about the enrollment. So traditionally, for those of you that are turning 65, that's when you're eligible for Medicare. God bless you. Okay? That's tradition. If you are under age 65 with Lou Gehrig's disease, that's really it, or end-stage renal disease, under that, you can be enrolled in Medicare as well. But traditionally, if you're turning 65, that's when you're eligible for Medicare A and B. Then what happens? If you're eligible, then you sign up for your A and B, either online, you go down to the local Social Security office, or if you're collecting Social Security prior to you turning 65 or disabled, your card will automatically come.
For A.
Well, it'll come for both, and you can switch it out. So you can get A and B, and then if you don't want B, you can send the card back, and they will give you just A. Now, one of the questions that I get all the time is, I'm under 65, and how do I get when do I get my Medicare Part A and Part B? When you're under age 65 disabled, it's a 2-year process. It's 24 months before you can be eligible for Medicare. Okay? It's not right away. Social Security looks at when you're disabled and when you turn, and then that 2 years is when they give you your card. Okay? You had a question?
I do have a question. Sign up, normally you're asked when do you need to get insurance. You have to sign up for the Medicare prior to turning 65.
Yeah, that's the enrollment. So now, if you're in the system,
If you're collecting Social Security or even if you're not collecting.
you don't have to collect Social Security to get into Medicare and get a plan, an advantage plan or a supplement plan. Okay? That's not required to collect Social Security. I just mentioned Social Security to collect it because you get your A and your B card. Okay? So that's when you're eligible for Medicare Part A and Part B. Now, when do you enroll? Well, generally speaking, when the month of your birthday, when you turn 65, is when you're eligible to get a supplement, an advantage plan, or prescription drug plan at that time. Okay? That's when you're eligible. Or when Medicare says gives you your card and tells you underneath what your Part A and Part B start dates are. Then you can do that.
Okay, what happens if you're over 65 and you have not signed up?
Okay? So let's bring this question back a little bit to fruition.
Because you have insurance.
Yeah, exactly. So you're employed.
Yes.
So now here's a kicker. If you are employed and still actively at work, and your employer employs over 20 people, you do not have to sign up for A and or B. Okay? Very important, but if you have to work for an employer actively at work, you or your spouse, because the spouse will follow the health plan, because if they're on it, they're the same rules. But if you're under 20, you're required to get Medicare Part A and Part B, because when you're work for an employer under 20, Medicare is primary. And then your group plan is secondary. Whereas if you're over 20, your group plan is primary and your Medicare isn't going to do anything. So you don't need to do it. And the reason you don't need to do it is because why spend the money, that $174, which is going to $185 next year, don't need to do it. But when you come off and retire, that is very important for you to make a change.
So that you make that change, we have to make that change this year. We're going to retire in July.
So another good question. A lot of people say, am I going to be penalized for this? When you're on a group plan, you are not penalized to go into Medicare. There's no such thing as a penalty either for Part A, Part B, or for the prescription drug plan, because you have credible coverage under your group plan. So the time that you are retiring, you're going to enroll. And I usually say, if you're going to retire, start the process a month or two before, so you can get your Medicare, ID number, because it's all you need, identification number, so that when you retire, you can then flip into the programs that are appropriate. Okay? Very important. But there will be no penalty. I get that question all the time.
So we don't have to do it at the enrollment time.
Do not. When you are enrolled in a Medicare program, then you're wrapped up into these time frames that we're talking about this year, from October 15th through December 7th, to make any changes for your Advantage plans or your prescription drug plan, standalone. Your supplement plans are month to month. You can change them any month that you want, as long as you qualify.
So did you say there's no penalty?
There's no
If you don't
penalty.
sign up 3 months before you turn 65?
As long as you are employed. If you're employed with an employer is over 20 and you have a group plan, you will not have a penalty. But if you are not employed or you work for a company that's under 20, you definitely need to get Part A and Part B, because you'll be penalized. Now let me throw this out at you. Those of you that are working, these group plans are high deductible plans these days. So you're paying deductible and then you're paying whatever. If anybody is contributing to a health savings account, which means that you're putting pre-tax dollars in, your employer can also put money in there under the group plan, do not enroll in Medicare Part A and Part B. Because if you do that, either on A, then you'll be, there'll be a penalty if you keep contributing to that plan. So they tell you that you can't contribute after that if you get into the Medicare system. So it's very important. All right? Good questions. Other questions? All right.
It's very dependent upon your situation. It's very situationally dependent. As you can tell, it's kind of like, okay, you ask a question, and then the patient almost, depends on your situation. So there's a lot of general rules, but it really once you have to hone it down between the individual and what your situation is to really kind of answer some of those questions. I know sometimes it can be kind of ambiguous and you get a little confused, but it really does become a very situationally dependent conversation.
Thanks, Rich. Rich had a good point here. It's individual. There's our number. There's no cost to call us or email us. You call us, we talk about it, we tell you what the scenario is, we help you, we guide you, and tell you what the scenario is. Okay? You have another question? Or?
Yes, I do. We talked earlier about my situation right now. So when this person, my daughter, gets the Medicare will have to be her primary. Right now, she has Medicaid and a supplementary. We don't use Medicaid as her primary. Okay, but when she gets Medicare, that will have to be her primary.
Depending on the level, so when you have a disabled person that's Medicare, Medicaid eligible, there's rules to it, and there's options that you have. So when that happens, we see what CMS states as what her necessity and what she's able to get, so we can put the pieces together, because it's not cut and dry. There's so many different conditions of what can be done. There's institutional, there's chronic, there's disability. So there's a bunch of things that we look at to see who's primary. Okay, so it's not, I wish I could give you a straight answer, but we'll have a side conversation on that. Okay?
What is this, one last question, I forget how to say it, but I understand on Facebook, I've seen these different things, advertisements, you can have both. But even if you went off of it, Medicaid and Medicare.
That's correct. Yeah, there's Medicare and Medicaid, has a program, and they're in advantage plans where things can be 100% covered. You're locked into a certain network, and depending on that chronic, I can't say chronic, but that's diagnosis or that situation will warrant what plan is best, what plans are out there. So yes, you can have a combination. They call them, D-SNPs, dual, Medicare, Medicaid programs. So they are out there that don't cost anything.
That just started this too, didn't it?
What's that?
That just started the first time.
No, they've been around for a long time.
I mean, to be able to do that with both?
Yeah.
Oh, okay.
Yeah, they've been around.
Led me to believe it just started that you could bundle, or is that word?
Yeah, no, for something with Medicare, Medicaid eligible, they've been around and they are separate. Still an advantage plan, but they're separate.
Okay.
Okay? Great question. Very good question. Anything else? Well, let's finish this up by winning some stuff. Rich, shake that up. Got some things going on here. I like to give away some things.
Money?
Yeah, possibly. All right. Have that gentleman take the first one.
$186,013.
Who's got it?
Congratulations.
All right, you tell me. You're going to win. Scratch off. Got it. Well done.
We love scratch offs.
We love scratch offs too. Yeah. Go ahead, Rich.
186012.
That.
Shake that up.
Go ahead, Rich.
Over.
Yeah, you got the table.
Get this scratchy bill.
186003.
Look at that.
Over here.
See that?
Take it down, Mike.
You're welcome. Everyone's got it. Thing,
One
right?
off.
Oh,
Go ahead.
now it's 002.
002.
That's me.
There you go.
Where's almost?
Okay, Rich.
How many we got here? 186011. I gotta get into the middle somehow.
Yeah, you shake that up. Hope everyone wins. What else, Rich?
186006.
Hear that? Hey, you might win $10,000 here.
That's right.
Hey, I hope so. With $10,000, I was really angry. That could have lied. Go ahead.
186014. Holy!
0, 1, 4.
Hey, you got
That
That was hers.
Oh, I had two chances,
I
huh?
was about to say. How'd that happen? 186010.
0, 1, 0.
Right here. All right.
Steven? Yeah, Rich?
005.
005? 005.
186005.
That's 005 down there? Let's see. No, you can't. Let's see. You have a ticket? Oh, I'm sorry. Where's that ticket at? Let's see, 005. There you go. Oh, that's you, scratch off. Thought so. Go ahead.
186018.
018?